welcome back to On Your Health Tech. And we have Sharmeen here. Sharmeen, introduce yourself.
Hi, David. I'm Sharmeen. I'm the founder and the CEO of Lyyvora. Lyyvora, it's a company. We provide health funding to healthcare clinics, mostly dental clinics and med spa. And our the people who look for funding in our area are the ones who got rejected from the banks. So we want to give them a second chance for the growth.
So, how do you raise funds? In what way do you raise funds other than getting bank loans?
So what we do is we have private lenders, and most of the cases that we have seen is the banks are extremely rigid in their underwriting, and they tend to reject those clinics who are eligible to get lendings to get credit, but because of their strict underwriting, they reject them. So instead of raising funds from the government, we look for alternative. What are the other lenders in the market who can give them money to grow the business? So giving you a recent example, I was helping a pharmacy who wanted to grow their business and open new areas. The bank gave them first time loan for 90% with approval, but when they wanted to open a second location, the bank gave only 50% of the of funding. The main reason is that the more you grow your business, the more business thinks that you will be risky and one day you will be bankrupt. While our lenders that I work with, they understand what is the healthcare businesses, and they see more potential in the story of a clinic rather than those strict rule of underwriting. So to simply answer your question is, instead of going to the to raise funds from government or somewhere else, which will take X number of months, we go to the private lenders who can provide funding within 42 to 78 hours, and just give them those access to get funding.
Gotcha. Are you're based out of Canada and France, correct?
Yes. So, well, not France anymore. I grew up and spent half of my life in France. In 2018, I moved in Canada. And so the clinics I help today are mostly Canadian. I can go to France, but I'm mostly helping in Canada than elsewhere.
So, which country do you like better? They both have you.
Oh, it's a very tough question.
Well, in terms of healthcare, which one do you like better? They're both universal healthcare, but there's different.
the Yes, but what I have seen in Canada is the clinics are more struggling to grow rather than in France. One thing, as you said, they both are they both have great fundings from the government to grow, Canada and Europe, especially in France. In France, we give so if I compare to example of the patient, so if there is a person who has a toothache and he goes to the dentist, in France, most of the time it is 80% to 100% covered, depending on your situation. But in Canada, by default, the patients are not covered. And then they are relying on the company insurances to cover the process. What it makes a difference is that at the end of the month, when the clinics they are claiming for the insurance, they don't get direct invoice. They have to go through all those processes, claiming 5 different companies, so that they will be able to get paid. While in France, it's straightforward. That much percentage of the patient has already been covered. They know that they will get the money by the end of the day. They don't have to play claims, etc. While in Canada, it's way more challenging. And that's why one of our clients, when they look for loans, they are more looking to cover up the cash flow. because the insurance are taking from 60 days to 90 days to get reimbursed to the clinic. So in terms of healthcare, I believe both countries are providing excellent healthcares. But in terms of struggle, I see more struggle from growth perspective and get paid perspective in Canada than in France.
Interesting. So, what do you think about America's healthcare?
US, it's a third challenge. I know that in terms of insurance and everything, Canada is better, is not better than Europe, but might be better placed than United States. So the good thing in Canada is that we do have health coverage for lower income people, while in US I'm not sure if this is the case. And so if I want to expand my offering, I would say after Canada, US is going to be the second country where the clinics needs more funding so that they can help more and more patients, especially those patients who are unable to cover the total price of their treatment.
Yeah, U.S. and healthcare in the United States is quite complicated. You got Medicaid and Medicare, which are similar to what Canada has for the low income and the elderly, but and there's no charge for service. Um, However, the private insurance industry here, you pay a copay, which is like anywhere between $30 to $50, and then your insurance pays the rest of your costs. How transparent is the Canadian healthcare system as far as knowing what costs are? Because that's the biggest thing in the United States.
I'm I would say that this is not as transparent as in France. The main reason is the company, they know that some of the amount will be paid by the insurance. So I see some of the bigger hospitals, they tend to hide the real cost of the treatment than showing us that this is exactly what is going to be. So there are two nuances. There are one who are dominant players that patient has no choice. For example, urgent care, ambulances. This is where Canada, I would say, is trying their best to charge the patient the real cost, but still, I don't say that there is still 100% transparency on there. Well, on the other hand, when there is a dental clinic, the dental clinic has the guidelines that the province provide to the dentist. So, for example, in Alberta, the Alberta has a full exposure of what treatment cost you. So all the people who are, for example, treating for a crown for their tooth, they know exactly what is the cost in Alberta. So when they go to the dentist, they can say that can you please show me how you're charging, and then compare it with the real price. So there are nuances in different areas. There are the things where government, and especially provincial government in Canada, disclose the real prices of the treatment, while there are some of them which are still obscure. So I'm not sure in United States we also have those criteria when we disclose in advance what is the standard price of something and how much you'll pay. But in Canada there are some.
Wow. So are you anticipating to expand in the United States in the next 10 years? Are you going to expand in the next 10 years in the United States?
Well, not even next 10 years, next 1 year or 2 years, we are planning to expand in the United States. The biggest reason is we know that there is a huge need in healthcare in the United States, but the reason why we are taking 1 year time is that we also need licenses and everything. But we will be sure be expanding by Q2 of 2026 in United States and helping those who needs funding for their patients.
Awesome. So how did you get your start in healthcare?
There is a personal story behind it. So when I'm personally belongs to a product design, I am a product designer, and we in Canada we get we get some funding from our company that we can use for the massage, for chiropractor, etc. So in last few years, I built relationships with my chiropractor and massagist, and one of my massages, she wanted to expand her business, and she was looking for some funding, and I was so surprised to see that when she went to the bank asked for her personal savings and her personal house as a collateral to give her some loan. At that point, I gave her my personal funds to start expanding her business. And then I'm so happy to helping her because she had been helping in for my body for the massage. And then I saw another similar case. Another friend, she was a chiropractor, and she had an accident, and because of that accident she had to stop her business for some time. She was again started looking for the funding, and she got 23% interest loan from the bank, from not from the bank but from her credit card. 23% is too much, especially for someone who is starting again or who had been in the bad time. Again, I help her with my own funds so that she will be able to run her clinic without 23% of interest. So when I was started seeing those areas, I said that it shouldn't be that complicated. Those are running businesses. They do have a good cash flow. They are all the signs that they will grow in 1 or 2 years. So why banks are not trusting them? Or if they're trusting them, why they're giving them so much high in interest? And this is where I started seeing that there are other alternate lenders who can help them with a lower interest than a credit card interest, and can fund on their story rather than on their P&L statement or their or the reason behind an accident. So this is where I took it as my mission, and leaving my 13-year plus job as a product design leader and solving this problem. So this is what energized me, and since I've started, we have helped 50 plus clinics, and we are doing more and more, and we have target to do at least 150 clinics before February 2026.
Wow. Um, so what is your uh, means of success? Is it relationships? Is it marketing? Is it word of mouth? What?
Can you please repeat?
So what's your means of success of expanding? Is it word of mouth? Is it marketing? Is it relationships? Or all the above?
Not yet marketing, most the relationship and word to mouth. So we had been extremely grateful for the people that we have been helped so far. They're just giving our expertise to others. But I believe that we can do more and we can help more if we do some more marketing. So I'm just starting to spend some money on the marketing and trying to reach more people who don't know us. But for now, our success had been word of mouth and the relationship that I have built in many years.
Wow. How do people reach out to you for Lyyvora?
So we do have a website. I will share this website link with you after this call. But usually I am extremely approachable and transparent. For being transparent, I share my personal number and book an appointment directly with me and not any other sales associate. So they reach out to me by phone. They go to my website, they book a call, and then I'll discuss with them that. The one thing that I try to do during this call is to understand where they're standing today. Have this conversation that how much money they might need, why would they need. And another thing that I'm doing is that I'm educating through newsletters. That, for example, there's something which is called revenue-based funding. usually clinics, they don't know that they don't have to go towards the loan path. They can also get funding through their revenues, so which means that they will pay the loan amount according to the revenues of months. So if they have a drop of revenue in December, for example, they don't have to pay the same amount. They will pay the percentage of their revenues to the loan. So those revenue based funding, equipment financing, all those things, the clinics, they tend to not understand what kind of financing they're choosing. So when they approach to me, when they book a call, I also educate them that what kind of funding might be suitable for them.
That's awesome. So, what's your next step in the next 10 years?
So I have started the healthcare. My ambition is that Lyyvora becomes the go-to platform where all the health clinics, whenever they have a slight problem of funding, they come to us and we will try to help them as much as I can. Today, only people that we helped knows us, or the people from the word of mouth. But in next 10 years, I want them that every clinic who's struggling, they come to us and we will help them to grow and to expand their business.
That's awesome. Are you hiring? Are you looking to expand that way in Canada?
In Canada and US.
Gotcha. Alrighty. Is there anything
The
you want to talk about?
there's one thing I want to
Sure.
yeah, there's one more aspect that I want to share here is when we started healthcare funding, it was on one side helping the clinics to grow, but on the other hand, we know that we are also an aging population. We are going to need more and more healthcare services in next 10 to 20 years. So if we help clinics to grow today, we will be helping us in next 10 to 20 years. So if I believe if I help clinics, a chiropractor to grow their business, and then if they can provide the best service they can, I might be able to use their service when I will be 60, 70, 80 plus. So this is a long term game, and this is the first area that we are trying to help to do that. Okay, that those chiropractor have all the resources they have, so that they will they can help their patient to be in their best health. And then when the population of United States and Canada grows, we have no problem of healthcare. We are all being in a good shape, in a good health when we are going towards 80s and 90s. So my long-term vision is on one hand to help the clinics, but on the other hand, help those patients who will get the best care from the clinics.
Wow. I know that the elder care in the United States is growing by bounds. A lot of, um, I guess you want to call it, uh, facilities where you put the elder people. Actually, I got hit by a car in 2014, so I was hospitalized for 4 months while I healed. So you can't go upstairs and put pressure on your foot because, of the weight of your whole body. Just my knee was in a cast. Um, so I had to be stationary. What kind of funding could you get for older patients who are going into a more of a facility type of living so that they can enjoy their later years without selling their home or anything else?
There's one beautiful thing in this healthcare space is that we are all connected. And I started having the partnership with those people who can help to patients. I'm personally working on the clinics, but my partners, if there is a case like this, where if I see, I can direct them to the right partners who will help those patients to go to those facilities. So what I see challenging in today's healthcare is the extremely solo industries. Instead of helping each other, the companies are isolated. They're looking for their profits and not exactly towards the collaboration. While we are growing in the clinic, I see an extreme collaboration with the landers who are helping patients. I'm giving you one example in Canada. So we have a partnership with a company who's providing patient care. So I have got contacted from a patient who needed a surgery, but who needed looking for funding. And again, they had no idea where to go. So I personally couldn't provide funding because we are helping clinics. But as I do have partners on the patient side, I diverted them towards to those people who can help them. So in near future, what I see is this big ecosystems where we are all helping each other to get the best treatment possible, to get funded when clinics or the patients need it, and to create these systems when there is no breakage. When the patients need, it's not only about funding, but if they need a place to stay for a long term injury, they can find a place, because we help develop clinics to develop those places in underserved areas. So looking in next 5 to 10 years, I see an ecosystem emerging where if the government is not there, we private industry, we are helping to connect one another and help the whole industry from clinic to the patient.
Wow. That sounds like you're on a great mission. What's your favorite quote? What inspires you?
I have so many good, but there's one thing that I would love to share here is, might have heard also, but it ain't about how hard you hit. It's about how hard you can get hit and keep moving forward, how much you can take and keep moving forward. So as I give you an example of a clinic who the person, because of an accident, she had to stop her practice and she had to start doing it again. So I believe that person is such an inspiring person for me, who got hit by the life, and touch the bottom end of the life, and then she get back again and then start helping other what she's doing, and I'm happy to see that she's doing even better than before. So yes, I would say the most inspiring quote for me is that it ain't about how hard you hit, it's about how hard you can get hit and keep moving forward.
That's awesome. All right, Sharmeen, is there anything else you want to say?
No, that's all, David. And also, it's so good to hear your story as well, that how you had been because of accident, and now you get back again and start solving this problem, not for yourself, but creating this voice where with your voice you can help others. And it's also another inspiring story that I'm hearing. So yeah, thanks for sharing.